Good afternoon once again. Today is Friday, April the 14th, 2020, and this is the English language summary of the daily press briefing of the Center for COVID Situation Administration, or the CCSA. If you allow, may I take off the mask because I am now on the podium and not close to anybody here in the production studio. Yes, thank you very much. So, of course, for this day and age, we have a new way of looking at things, a new perception. We look at things in terms of, our outlook would be in terms of we now more than me. Of course, that is self-explanatory. And around the world, there is now the risk of the second wave of asymptomatic cases. We hear in the news that there is the reemergence of COVID cases in distant cities in some countries. And of course, we have to be very mindful and very cautious of this second wave. So here at the CCSA, if we can say the words, let's help prevent the second wave, if we can say that like 10 times a day, we would. But of course, if we are not mindful and cautious of the second wave, all of our resources, all of our efforts in the past weeks and months would be lost. So I would just like to repeat once again, let's help each other to avoid and prevent the second wave. Also, since I mentioned yesterday already, and I'll repeat again today, we're entering the holy month of Ramadan. It officially started. So once again say Ramadan Mubarak to all the Muslim community in Thailand as well as around the world. Moving on to the general situation and the numbers that we have to report to you for today. The new number of confirmed cases is 15. So we have 4 out of this 15 which were found through the active case testing or finding method. So 4 out of this method were discovered. 4 out of 15 were discovered through the active case finding, and this was in Yala province, making the number of cumulative cases in Thailand 2,854. The total number of recoveries is 2,490, an additional of 60 from yesterday. And new fatalities, nice to report to you today that there is no fatalities reported for today. The accumulated total of fatalities in Thailand therefore remains at 50. Just some observations from the numbers of new cases as mentioned by the spokesperson. Right now we have 10 provinces in Thailand that have not found new cases of COVID for the past 28 days. We don't use the benchmark 14 now, we use the benchmark 28. Yesterday, I believe this was 9. The number was 9 provinces. Now we have 10, the additional province being Cha Cheong Sao province. Also, another observation is that we still have a number of active clusters of infections, such as in areas like Chonburi province, Phuket, Pattani, Yala, and Chumphon provinces. And each cluster involves around 5 to 51 infected persons. Their risk factors include their working environment in a congested area, being in close contact with tourists, and having attended mass gatherings or congregations. Since April the 7th, 2020, we have also expanded the criteria of the PUIs, persons under investigation, which we mentioned yesterday already as well, to be more inclusive. So the criteria for PUI will be more inclusive. So from now on, the number of PUIs have amounted to 19,010 cases, with 619 tested positive, with a positive rate being 3.26%. In the meanwhile, the authorities are also boosting the capacity of the laboratory testings of COVID. Currently, we have 123 laboratories around the country, both public and private, which in some they can test around 20,000 samples per day, and half of these are done in Bangkok. Yes, moving on to the enforcement of curfew issue, we have violations in terms of leaving residences, 446. I think this is a lower number than yesterday comparatively. In terms of violating, in terms of gathering, it's 39, making the total 485 for yesterday, for last night. And in a bit detail in terms of the monthly range, we have statistics such as from the 3rd to the 22nd of April, it was found that 10,858 people were prosecuted for leaving their residences during curfew in that range a month in terms of 3 weeks. And 1,972 were prosecuted for gatherings in large groups. And in both cases, more than half of the violators were male, and the largest group is aged between 19 and 30 years old. Moving on to the issue of Thai nationals abroad, we have information for you for the repatriation flights coming in for today and tomorrow. There will be repatriation flights to bring back nationals, and all returnees will be quarantined according to the standard procedures. Yes, on screen you have the scheduled repatriation flights for today and tomorrow. For today, April the 24th, a flight from India bringing back 171 Buddhist monks and pilgrims, and another flight from Japan taking home 31 Thai nationals. The flight from Japan will also include Thai nationals traveling from Canada who transited and had to connect their flight in Tokyo. For tomorrow, we also have that on the slide. Tomorrow, Saturday, one flight from India again, scheduled to repatriate another group of Buddhist monks and pilgrims. And another flight from Iran tomorrow, taking home 21 remaining Thai nationals, mostly students in Iran. I believe we also have a slide in terms of air repatriation, in particular, a summary, a new format of slide for you in English on screen now, yes. So during the 4th to the 23rd of April, we have repatriated 1,940 Thai nationals from 16 countries. All of them screened and sent to a total of 20 state quarantines. In this number, 71 tested positive for COVID and are still being treated in hospitals. And 1,621 of these returnees remain in state quarantine up to today, while 248 of them have already returned to their respective hometowns. And from the 24th to the 30th of April, there will be another 1,382 Thais being repatriated by air. We also have a slide in terms of land repatriation, which is on screen for you now. Yes, from the 18th to the 23rd, for that range of days, there were 2,589 Thai nationals repatriated through land borders, all of them screened and sent to state or local quarantines, and most of them entered through the southern border checkpoints, and the rest arriving through other checkpoints. And from the range of 24th to the 30th of April, the last 7 days of April, we expect to have around 2,500 plus Thai nationals coming in the border checkpoints. Yes, moving on to the activities of embassies and consulates abroad who continue to provide assistance to the Thai nationals abroad. First, we have some slides, some pictures on this for you as well. From countries like Singapore, the Thai embassy in Singapore, here, yes, you see on screen, distributing emergency supply kits to Thai workers in the labor sites in Singapore. Yes, in our Thai embassy in Vienna, we have images here of the ambassador and the staff sewing face masks and distributing them to the Thai communities in Austria by mail, sending them this by mail, by post. Yes, the next images we have is in the Thai embassy in Manila, the Philippines, providing masks and supplies to the Thai community, the Thai exchange students as well in the Philippines. And the next image is the Thai embassy in Pretoria, South Africa, supporting the necessary supplies to the Thai community. And finally, we have the Thai embassy in Cairo, Egypt, supporting food supplies to Thai Muslim students to prepare for Ramadan. Yes, thank you. And of course, we have, as I mentioned yesterday, our international cooperation continues. Yesterday, there was the special ASEAN-US Foreign Ministers meeting on COVID. The meeting reaffirmed the shared commitment to enhance cooperation in COVID. We have some images on screen for you. The foreign minister reiterated the importance of digital economy in mitigating the economic impacts and the importance of assistance to nationals during the crisis. He also proposed for both sides to strengthen cooperation in terms of digital infrastructure vis-a-vis crisis like COVID, and to mitigate the disruption in terms of supply chain and necessary transport of necessary goods, medicines, and medical equipment. The ASEAN-US Foreign Ministers meeting also heard the US Secretary of State informing about the public health emergency assistance to be offered to ASEAN member states amounting to $35.3 million US, and the new initiative called the ASEAN-US Health Futures, as well as the plan to elevate the U.S. Center for Disease Control and Prevention to serve as a regional mechanism to support and prevent and monitor future possible outbreaks in ASEAN. Another piece of information we have is about the inquiries that you have sent, the English language community has sent to us through various channels. One question which the spokesperson actually addressed as well is that, is the government preparing to lift the curfew after the end of this month? So the answer is no decision has been made yet. That is still being deliberated. The government and the CCSA will have to consider the prevailing circumstances, and any extension of the existing measures or introduction of new measures will have to be approved by the cabinet. And it's possible that some restrictions can be gradually relaxed, as I highlighted yesterday as well, but we'll have to wait for the final decision. And of course, if we are on the way towards relaxing measures, please don't relax your guard. Because as mentioned by the spokesperson as well, we are in a new normal, the times of new normal. I believe the translation for our Thai audience of new normal might be ชีวิตวิถีใหม่ new normal ชีวิตวิถีใหม่ and the general advice as always in this new normal, this time of new normal, ชีวิตวิถีใหม่คือการใส่หน้ากากให้มากขึ้น การที่จะมีการทิ้งระยะห่าง social distance ให้มากขึ้นเพื่อความปลอดภัยของทุกคนนะครับ wash your hands often, wear face masks, keep physical and social distance. And of course, in the battle with COVID, having strong mental health and emotional health is very critical for everybody to be safe and sound. So in this regard, the Department of Mental Health, กรมสุขภาพจิต has issued an advice for all of us. It's kind of a catchy phrase. In Thai, it is อึดฮึดสู้ I am, I have, I can. I am is to know yourself and recall how many crises have you overcome already in the past, so as to strengthen your own morale. I have, excuse me, is to explore the potentials you have and what can be developed. Both will lead to I can, which is to be confident in yourself that you can get through any problem and create new things. So in short, be happy with who you are and your preparation. That is I am. Be content with the joys in life you possess and that you try to build upon what you have done in terms of prevention, to be safe, to be healthy. That is the I have. And be confident in your strength and your potential to overcome. That is the I can. To overcome this challenge of COVID together. And finally, just in closing, we offer our best wishes and hope that we will be fighting off the second wave together. We are one with you, both the Thai people in Thailand as well as the foreign community in Thailand. We also offer our moral support to all the countries around the world that are still facing challenges, be it in the Americas, be it in Latin America, in Europe, or ASEAN friends, Singapore, Malaysia, Indonesia, the Philippines, so that we can together fight off COVID. Just in closing, I wish to offer the best wishes as well to the Thai community around the world. May you stay safe and stay healthy. ขอให้ชุมชนไทยที่รับฟังอยู่ทั่วโลกในทุกทวีปนะครับขอให้มีสุขภาพแข็งแรงแล้วก็มีความสุขแล้วก็มาร่วมกันสู้และต้านโควิดไปด้วยกันขอบคุณมากครับ Good afternoon. Thank you. สวัสดีครับ